So are there other natural alternatives that we could be using if we're not using CBD because it's clearly not evidence-based yet?
Yeah, so a lot of interest in natural remedies, and I think that's reasonable. I think overall there's still a lack of research, and we need a lot more research to explore that area. Um, Unfortunately, you know, it's difficult to get funding. It's difficult to do those trials without funding. So that's a bit of a double-edged sword. But best evidence is probably in the ADHD area. So omega-3, there's a lot of interest in omega-3 for ADHD, and there have been 10 or 15 randomised controlled trials of omegas. And the evidence base, it's a little bit hard to interpret some of the evidence, and the trials aren't massively robust. But omega-3s may have a mild positive impact on ADHD symptoms, and they're pretty benign, and so I wouldn't discourage people from trying those. I often ask people, what have you tried when they come into the service, and frequently people have, and it's kind of mixed reports. Some people have found it helpful and other people not. Locally, micronutrients is an area of interest. So Julia Rutledge's group out at Canterbury Uni, so she's done a trial in adult ADHD, and another trial with ADHD in young people, looking at 25 vitamins and minerals in quite high doses. And those trials are interesting, a little bit variable, but the psychologist who meets with the relevant person overall found about 50% had a positive response to the micronutrients, like looked better overall, compared to about 20%, sometimes a little bit higher, on the placebo medicine or placebo arm. But for ADHD symptoms themselves, there are probably some fairly modest benefits, possibly for inattention. A little bit more evidence in the adult trial, but teachers and parents weren't really rating ADHD symptoms as being hugely different. There did seem to be some benefit for things like emotional regulation and possibly some aspects of other behaviour. So interestingly enough, Julia and I did an application to Pharmac a year ago, and Pharmac have considered micronutrients as a possible intervention for ADHD, and they've said that they will give that low priority, which is Pharmac speak for yes, there's some evidence for that and it could have a role, but it's low priority for funding at this stage, and so it's a little bit of a wait and see, but that's a start. When people ask me about micronutrients, I always suggest they try medicines first, because the evidence base, I think, is stronger. But if people don't have a good response and they can afford it, it may be a reasonable option.
Can they be used concurrently?
The micronutrient people say it shouldn't be, but I have had a few people anecdotally where they've used it concurrently, and there haven't been a lot of adverse effects. Interactive adverse effects. So, yeah, I don't know. It's a bit of a tricky one. I think you probably need more evidence, but I think it could be worth a go if people had a suboptimal response and it was something you wanted to have a look at. And again, I'd encourage people to get a rating scale from relevant people before and do it after, and just see, what has it done after 3-4 months, rather than committing to it for a very long time if it's not useful.
So if you've got an option of supplementing micronutrients, are there vulnerable groups of people in the community that may already have malabsorption or malnutrition?
Yeah, there probably are.
Where that would really
Yeah,
be beneficial?
so there are studies of kids with ADHD where their omega-3 markers are kind of lowish, certainly in some people, and ADHD similarly, sometimes vitamin D deficiencies, sometimes iron deficiency, and if people have a deficiency, remediating that's probably helpful. But we looked at that with the trial with Julia with the ADHD kids, and nutrient level before the study didn't predict who responded and who didn't. So yeah, I kind of don't really know. It's kind of a bit of a work in progress.